Good afternoon, everyone, and it is lovely to see you. I see
Mhm.
some of you have managed to get to hairdressers and barbers and such like, and some of you haven't, but you all look lovely. My name is Sean Holland, and I'm going to be your chair this afternoon. I'm the Chief Social Worker for Northern Ireland, and hopefully will guide you through this virtual event without any hiccups. Today's event is being brought to you by CES, the Centre for Effective Services, and Campbell UK and Ireland. CES is a non-profit organisation. It works on an all-Ireland basis. I've had the pleasure of working with them on a number of things over the years, and it's a great organisation. They particularly work with government departments and their agencies and service providers, helping them to use evidence to inform policy, but also really importantly, focusing on how to then subsequently overcome the challenges of implementation. This is my first time working with Campbell UK and Ireland, although I have had the pleasure of working with some key personnel in other guises, and looking forward to that. Campbell UK and Ireland are part of the Campbell Collaboration, which is an international non-profit research network. And today we're going to hear about 3 systemic reviews on homelessness, which are being published by Campbell UK and Ireland today. It's important to mention that these reviews have been funded by the Centre for Homelessness Impact. In addition to hearing directly about the reviews, we're going to have inputs by key people who are going to share some of their views on homelessness from policy, service provider and implementation perspectives. And in addition to the different presentations, we're also going to have a panel discussion at the end. So if you want to raise any questions or make any points, please use the chat function throughout as we go through, and we'll try and get to those points when we get to that panel discussion towards the end. Now, as with all of these virtual events, there are some ground rules, and they're really simple. Really basically keep yourself on mute, please, throughout. Otherwise, we can get all sorts of chaos going on. If you find your connection is going a little bit dodgy, it can sometimes help to turn off your camera. That can help. And the most important ground rule, it's the same for a virtual event as it is for a live in-person event. Let's all treat each other with respect and kindness, and be prepared to change our minds on the basis of what we hear today. Now, we've got a really diverse group of people who have decided to join us this afternoon, which is absolutely brilliant. Lots of different backgrounds, even different countries. And we'd like to know a little bit more about you. So we're going to kick off with a bit of a poll. And it's really simple poll. And it's just helping us understand a little bit more about who you are coming to this event today. So what's your area of work? Are you someone who works for a service provider, a government department or government agency? Are you involved in research? Or are you one of those wonderful group of people that we all find ourselves in every now and then called other? So if you could click on that, that would be great. If by any chance you haven't been able to see the poll come up on your screen, just answer it in chat. Just put your answer in chat saying, you know, I'm so-and-so and this is my background, and we'll take it from there. Okay, I think we're ready to move on to our first presentation, and this is the really substantive presentation that looks at the reviews that I mentioned before. So we're going to be hearing from Dr. Jennifer Hanratty, who is by profession a research psychologist. She's got a background in evidence synthesis and evaluation. Recently joined CES as a project specialist, but before that she worked with Campbell UK and Ireland, and she was part of the team at Campbell that conducted these 3 reviews. So is absolutely perfectly positioned to take us through the detail of the findings. So Jennifer, I'm going to hand over to you. Thanks very much and welcome.
Great, thanks very much, Sean. I'm going to talk about the findings of 3 reviews that were undertaken by Campbell UK and Ireland, led by myself, Professor Sarah Miller and Dr. Ciara Keenan. And the first thing to say is that we are experts in evidence synthesis and systematic reviews, but we are definitely not experts in homelessness. So I want to acknowledge the contributions of the wider research team, including Professor Terry Pigo, who is an expert in meta-analysis, but also our homelessness experts, Professor Suzanne Fitzpatrick and Dr. Peter Mackey, and colleagues at Queen's, John Carman and Alan Maddock, who also contributed from an expertise in homelessness. So for those of you who aren't aware, the Campbell Collaboration is an international voluntary non-profit network of academics who work to produce high quality evidence synthesis and systematic reviews. And the goal of the Campbell Collaboration is to help people to use evidence to make better decisions and better quality policy decisions and using evidence. And the key thing to say about Campbell systematic reviews, I won't go into the detail of the methodology of them, but we go through a really, really rigorous process in terms of gathering all of the available evidence to answer a particular question, put that evidence together to try to generate new insights and new information about what the evidence can tell us. So Campbell reviews are very high quality products in themselves. And the Campbell UK and Ireland is one of the first national centres for the international Campbell Collaboration. And Campbell UK and Ireland works to help to promote the work of Campbell throughout the UK and Ireland through producing high quality systematic reviews, but also encouraging and supporting their use through training and other activities across the island. And so the 3 reviews that we worked on were commissioned by the Centre for Homelessness Impact. And the Centre for Homelessness Impact is a relatively new What Works centre that was set up in 2018. And their focus is on improving the use of data and evidence to prevent homelessness or to end homelessness. And that's their goal. And the Centre for Homelessness Impact had commissioned 2 evidence and gap maps. Like the Campbell Collaboration produced 2 evidence and gap maps. One of those was on the effectiveness of interventions for homelessness, and the other was on the implementation of interventions for ending homelessness. And those evidence and gap maps, the purpose of them is to try to identify and map out all of the available evidence on that very broad topic of interventions for preventing or reducing homelessness. And what we then did in collaboration with the Centre for Homelessness Impact was identify where there were enough primary studies on a particular topic that hadn't yet been put together and synthesized. And so that's how we got to the 3 topics for the reviews that we undertook. So the first review was on accommodation-based approaches to reducing homelessness. The second review was on discharge programs for people who are at that transition point from leaving an institutional setting, such as a prison or potentially inpatient treatment for physical health and mental health problems or substance use, and also people who are aging out of care. So anyone who's leaving an institutional setting, transitioning into the community. And the third review then was on any interventions that were designed to improve access to health and social care services for people who were either experiencing or at risk of experiencing homelessness. So there's a lot in these reviews, so I'm just going to go through the kind of headlines for the 3 of them, but just to tell you a little bit more about the evidence that we included in those reviews. So what we included was the best available evidence from high income countries. We only included, for the studies on effectiveness of these interventions, we only included studies that allow some element of causal inference. By that, we mean that they had some kind of a control or comparison group so that we can be confident that any of the findings that we identify from the studies can be attributed to the intervention itself and not any external or other factors. The existing studies that we were able to identify were of mixed quality, but unfortunately they were generally of low quality. And so there's already a gap there in terms of high quality evidence. And then as well as the effectiveness studies, we also include studies on the implementation of interventions. And we sampled those studies from across different contexts. And the reason that we did that was because we saw that the vast majority of the studies on the effectiveness of interventions take place in the USA. So that when we looked at the evidence on the implementation of interventions, we made sure to draw that evidence from across a wider range of high income countries, including the UK, Ireland, Europe, and the rest of North America. In terms of the population that were included in the studies, in these reviews, we kept it very broad, so it was anyone who was at risk of homelessness or currently experiencing homelessness. The majority of participants in the studies were men with complex needs, and so we would have included studies that were on families, but they weren't. They weren't there. They didn't meet the inclusion criteria for this review. In terms of the 3 different reviews, the interventions that we were interested in, for the accommodation review, what we were able to do there was that we were trying to not just compare different types of accommodation interventions with treatment as usual or with doing nothing. With that review, we were able to do a network, what we call a network meta-analysis. So we were able to actually take different interventions on different studies on different interventions and group them together so that we could compare the relative effect of different types of accommodation-based interventions. And when we started that process, we realized quite quickly that there was no agreed typology of how these interventions were talked about. There was lots of different terminology for different things, or different terms for the same things. And so what we did was constructed our own typology and then categorized each of the studies into the typology that we then had generated. And that was based on the conditions associated with accommodation. So whether or not somebody had to satisfy any conditions before they got access to accommodation or not, the stability of the accommodation, whether it was transient or temporary or a permanent home, and then the level of support that was also associated with the accommodation offer. So either low, moderate or high levels of support. Then for the review on discharge programs, those were programs that typically involved coordination of multiple agencies and services. They usually started well before the point at which a person was leaving the institutional setting and then continued after they left the setting and moved into the community. So there was kind of continuing tapering support for a lot of those interventions. And then for the review on access to services, we included any studies that were in a community setting, and the study had to examine some element of a service changing the way that it operates or supporting people in order to access health and social care services. So I'm going to very quickly just run through the kind of headline findings for each of the three reviews. So in terms of the accommodation-based approaches, we identified 28 studies in total. 25 of them were conducted in America, 2 in Canada and 1 in the UK. Overall, it was quite low quality evidence. There were gaps in the evidence base, but we were able to say quite confidently that providing accommodation with no strings attached, with high levels of support, that is the thing that works best to improve housing stability and also to a lesser degree people's health. We were also able to find that accommodation with any level of support was better than accommodation on its own or doing nothing at all. And the third thing that we were able to demonstrate by comparing the network of different types of accommodation-based interventions was that we found that those accommodations that were temporary, had conditions attached to them, had low or no support attached to them, they were actually worse than doing nothing. And in terms of the review on discharge programs, we found that the evidence was quite sparse. There were 13 studies, but 8 of them were randomized trials. So the evidence there was promising. And we can say quite confidently that these programs can substantially improve housing stability. There was evidence that they can also reduce the number of times that somebody ends up back in hospital. And then we can also say that there is some evidence that there is a reduction in the risk of someone going to prison, or in this case, most of the studies were on people who had been moving from prison into community settings. So there was a reduction in the risk of people ending up back in the prison system. The evidence there wasn't quite as strong, and so it's tempered by saying it might or it may reduce the risk of incarceration, but it's quite promising given how costly that can be as an outcome. And then in terms of the review on access to health and social care services, can these interventions work to improve health and social care access? Well, the answer is yes. Essentially, the interventions were successful at improving access in 2 different ways. So either they changed something about how, where, or to who the service was delivered, or they actively sought to remove barriers to access for people who were homeless. So that specific population that the intervention was targeting, removing barriers to existing services so that the service was more accessible to people who are experiencing homelessness. And we can also say that these interventions might lead to improved outcomes in health, but the interventions often did more than just target access to health and social care services. So we can't say for sure whether the improving access was the thing that caused the improved outcomes. It may have been the other things that the interventions were doing that led to the improvements in health. And then looking quite quickly at the evidence for the implementation, we looked at, so this is kind of drawing the evidence from the 3 reviews together to sort of look across the board. And we look at different levels in terms of implementation. And so the evidence suggests to us that quite obviously the context is going to have an impact on how well these interventions can be implemented. So the availability of housing, employment welfare safety net is quite important. And we know that because quite a lot of the evidence is coming from the United States, the social context and the economic context is very different to what we have here. So we have to be careful when we think about transporting interventions into this context. And the level of policymakers and funders, and also at program administrators and managers or agencies that were implementing these interventions, having a shared vision and commitment to preventing homelessness rather than managing homelessness was important. And by that, I mean viewing homelessness not as managing the number of rough sleepers, but actually moving earlier on in that process towards early intervention and prevention, so that people don't get to that point, was more successful. At the level of program administrators, having buy-in with leadership was that approach to ending homelessness or preventing homelessness was then reflected in the culture and priorities of the agencies, which then made implementation run that much smoother. And a couple of quite obvious points about these interventions: that interventions we can demonstrate that they are effective, but if they're not delivered as intended, then they're not going to be effective. So sticking to the protocols is quite important, and often something that doesn't happen in practice. And when we look at the level of staff and caseworkers, buy-in from staff was quite important in terms of commitment to the ethos of the interventions. Having good communication between clients and communication between other agencies was important, and investing in training for teams to equip staff with the skills that they need to deliver and foster a sense of responsibility for addressing homelessness. And by that we mean that they may be in contexts where people don't feel like addressing homelessness is actually part of their role, then they're not going to embrace the delivery of these interventions. And from the perspective of people who are in receipt of the programs, one of the things that is common across all of the studies that we looked at in the 3 reviews was that these weren't one-size-fits-all approaches to intervention. It was very much about assessing individual needs and preferences and then matching those with appropriate services. And for people who are in receipt of the programs, those needs aren't going to become evident until you have time to build a relationship and a trusting relationship between the service provider and the person in receipt of services, so that those needs can come to light and they can work together in partnership. Access to both housing and non-housing support were both important, so it's not one or other being more important, both are vital. And the 2 last points there around providing sufficient information in good time was quite important to people in receipt of intervention. Often information comes quite late in the process, and so people don't have time to prepare for upcoming changes. And very practically, having services where and when people need them. There's no point in having an excellent service that only runs on a Monday from 2 p.m. to 4 p.m. when people need services outside of those hours. And I think that's my whistle-stop tour of the reviews. Thank you.
Thank you very much, Jennifer, and thank you for being very disciplined about time. As I said earlier, please, if you have points or questions that are arising for you as a result of any of the contributions today, please put your point into the chat box and we'll try and get to it in discussion. Something I should have mentioned at the beginning, this session is being recorded. So if that's an issue for any of you, another reason to keep your camera turned off. Moving along, we're going to next to Grainia Long. Grainia is the Chief Executive of the Northern Ireland Housing Executive, which is the Housing Authority for Northern Ireland, one of the largest publicly owned landlords in Northern Ireland. I also actually think that it's probably one of the most significant figures in the history of Northern Ireland over the past 50 years. People think of individuals like Ian Paisley or Jerry Adams. I actually think the Housing Executive, when the history of this place is written, will be as significant, if not more significant, than any individual. Previously, Grainia was the Commissioner for Resilience for the City of Belfast and co-chaired the Belfast Climate Commission. She's got extensive experience working in housing, including as Chief Executive of the Chartered Institute of Housing. Grainia, you're very, very welcome, and over to you.
Thank you, Sean. Thanks very much indeed, and thanks to Centre for Effective Services and Campbell. I'm really pleased to be part of this discussion today, and I really enjoyed Jennifer's presentation. I was scribbling lots of notes, Jennifer, and look forward to the discussion. So, as Sean said, just for those of you who aren't familiar with the Housing Executive, it is quite a unique organisation in many senses, and we're 50 years old this year, Sean, the organisation is, and so actually we're spending quite a bit of time, as you can imagine, thinking through our purpose and our impact, and actually the issue of homelessness and just where we are now in terms of the scale and the nature of homelessness in Northern Ireland is front of mind. It's a priority. I'm in post about a month, I think, or 6 weeks, a month or 6 weeks. You know, it's an absolute priority for me personally as somebody who worked in homelessness at various different points in my career. But actually now kind of resetting our approach to homelessness and resetting our approach to service delivery kind of post-COVID. I think there are you know, there's a real moment now to learn lessons. So I think, Jennifer, the reviews are come at a critical time, actually, so it's been really helpful. And I'm sure we'll look at them in more detail. Apologies, my lighting is a bit dark. Apologies if you can't see me very well. So I want to start by just talking briefly about evidence and the role that it plays in my organisation. And again, the Housing Executive is the Strategic Housing Authority for Northern Ireland. So essentially, we undertake this, you know, the role that you would expect. We assess need. We work with and assess individuals when they present as homeless to the organisation. We make decisions in relation to the allocation of accommodation and the appropriateness of accommodation and so on. But we also are a landlord with 85,000 homes. And actually, the fact that we do both things, I think, really contributes to having a really strong focus on evidence within the organisation. So coming new to the organisation, I was kind of doing that kind of scratching beneath the surface that you do when you join an organisation and looking for things that make this kind of culturally interesting organisation. And actually the investment in research and evidence, I can really see it within the organisation. But I think that's really born of investment in people and in skills. And so, you know, having a research budget and sticking it over there to the side, and not actually integrating evidence and research just isn't good enough. So what I've found in this organisation, as I say, possibly because it's 50 years old, but I'm sure a number of decisions over successive years have really ensured that we invest in evidence and research. And so when we're making decisions about services, so they're person-centred, they're people-centred, they're evidence-based, and that the data drives them. Now, we won't get that right all of the time, so I'm not going to suggest that it's a panacea and we do it brilliantly absolutely every day. But what I do see is a very strong focus on data and research and evidence in driving service design. And I think there's more that we could do. And I think, Jennifer, some of the points that you made in the research really shows actually the importance of taking a very holistic approach to research and analysis and looking beyond your organisation and your jurisdiction, but looking way, way beyond into other areas. So I suppose that's my first key takeaway for you know, from my experience, is that, you know, investment in research, but investment in the people who do research and investment in the systems that support that research is really important. But it is not cheap. It doesn't come cheap. And actually, I think that's often the challenge. Oftentimes, these are some of the first budgets to be cut in difficult periods, and then what we end up with is less evidence-based and therefore poorer services as a response. So I'm kind of really conscious of that as we look beyond COVID. I want to talk a little bit about why, I suppose, evidence is critical. And look, I'm talking to a group of people. I've seen in the chat, you know, everybody's backgrounds and so on. So you're all clearly housing professionals, you're professionals working in this area, or health professionals or social care professionals. So you will know this, but, you know, the intractability of homelessness makes it one of those issues, you know, in kind of social policy terms, a wicked issue. It makes it one of those issues that requires a really strong focus on evidence, because, you know, the issue with housing and homelessness is that you pull at one lever and it has a ripple effect across the housing system. So therefore, you know, the better the research and the better the evidence, the less likely it is to have those unintended consequences. So again, something I'm looking at within the Housing Executive is how we ensure that we're capturing those broader impacts when we make decisions, that we understand the full effects of those decisions. So we're not just making decisions on an individual basis, but we're actually thinking systemically about it. In terms of lessons for kind of beyond COVID, and I'm going to just touch on a few because we've lots more time for discussion. We are at a real moment right now as we begin to emerge, and I really do say begin to emerge from the impact of COVID-19. And it has given us an opportunity as an organisation to take stock. We've published a reset plan on homelessness. And I take no credit for the fact that it's called a reset plan, because it was put together before I joined the organisation. But what I like about it is it's a plan and not a strategy. It's a get on and do it document, and it's for immediate delivery. And in developing that reset plan, the teams across the Housing Executive sat down with that network of voluntary community sector organisations, statutory organisations, and the range of organisations that they've worked with over the last year to respond to the impact of COVID-19 and prevent a public health crisis amongst our homeless population, and spent probably not enough time, but as much time as we could find to start thinking through how do we take those lessons, how do we absorb some of the lessons from COVID, and how do we now use them to change how we provide homelessness services in the future. A number of key issues came up: collaboration and the ability of a whole range of organisations to move with absolute speed and agility, take decisions quickly, undertake, I suppose, risk sharing. So sharing budgets, sharing people, sharing skills, sharing assets, sharing accommodation, and being able to do that quickly and speedily. So there's a general view, and I'm really interested in everybody's perspective on this, but there is a general view that even though we didn't get everything right during the pandemic, that actually the things that we did get right, we really need to point to them and take them with us as we design services into the future. The second is the really obvious one, and you touched on it, Jennifer, is the integration between housing in its purest sense, as in accommodation and housing support and health and care services, and the relationship between those. And you can see, I mean, it's really obvious where we get it right, and it's really obvious where we still continue to struggle actually in that integration. And I'm not surprised actually in some of the findings of the research. Jennifer really kind of pointed to the centrality of support services. I mean, anybody who's been working homelessness for years can see you can absolutely, if you fund housing support and you fund it well and you fund it in the right way, you can really tackle chronic homelessness and really succeed in terms of prevention strategies and prevention interventions. So the kind of integration there and the relationship between housing and health, and there's so much more that we need to do, and we need to be much better actually in ensuring that housing professionals, homelessness professionals are working alongside health professionals. And I think there's I think we're going to see some excellent practice in the future. I think the third one, and this is anecdotal and probably not backed up enough by evidence, so Jennifer, forgive me, but the third one that really has come out is the fact that systems change is possible. In other words, we did things in the last year that we would not have been able to do other than we were trying to prevent a public health crisis amongst our homeless population. We were trying to ensure appropriate accommodation was provided. We were trying to ensure that wraparound supports were given and people were moving at speed. And we were also, by the way, as you all know, because I can see you, many of you, all of you still at home, we were all doing this while dealing with the personal issues that we all had to deal with, while passing children back and forth between partners, or indeed looking after older people or looking after friends and so on, or shielding ourselves, all of those issues. But the fact that systems change is possible, and what I'm really interested in is what have those systems changed now given us in terms of improvements, but also where have we gone wrong? And I think we have to have an honesty here as organisations, and I'm really keen that the Housing Executive is one of those organisations that is honest when it gets things wrong, as well as is honest when it gets things right. And so I think the test for me as we go forward is that we do that. I'm conscious of time. I've mentioned already skills and investment in people. I spend a lot of time speaking to partners in other organisations as well as listening to my colleagues in the Housing Executive, and people are really exhausted. They've had a really difficult, busy year. They're worried about their own teams. In some cases, they're worried about their jobs. And so I think the investment that organisations make in health and well-being for frontline staff, for people across organisations, will be the difference between services really sustaining and thriving, or services really disimproving over time. So we have to get that right. And I would be really interested in the research that shows those kinds of organisations that have gotten it right, and where the evidence can back that up. And then the final one for me, in terms of as we go beyond COVID and how we use evidence and research, is how we really get strike the balance now between the physical standards in accommodation and management standards in accommodation. And again, what we've seen over the last year is some examples of really excellent practice in the placement of people in appropriate accommodation. But we've also arrived at a situation where far too many people are in inappropriate accommodation that was only ever intended as on an emergency basis or on a temporary basis, and are there for far too long. And we're going to see as we emerge from COVID, real issues in relation to mental ill health and a whole range of other complex problems. Final 2 points for me, just observations on the research. As you said, Jennifer, the centrality of support to making accommodation and placements work is critical, and I think we all know that. But I was really struck by what you said about that shared vision to prevent homelessness rather than manage it. I personally, I go to work every day, to not to manage issues, but to solve them or resolve them. And I think many of my colleagues do, and I'm sure many of you do too. But I think it's really important that we continue to point to that, because it's very easy to stop doing it and to just institutionalize problems and manage issues rather than really try to solve them. So just a few observations for me, and I'm happy to speak further. Thank you.
Okay, thank you very much, Grainia. Fascinating insights to someone leading a very, very large organisation as it prepares to emerge from the pandemic, and identifying where we go to next, forks in the crossroads and what have you. Okay, next up, we're going to be hearing from Bob Jordan. Now, Bob is National Director of Housing First in the Republic of Ireland, based in the Dublin Regional Homeless Executive. He's responsible for driving the national rollout of Housing First and ensuring that government targets are met. Prior to his current role, he was a special advisor in the Department of Housing, and he was CEO of a housing charity many of you will know, Threshold, from 2007 to 2016. He was also a senior manager in the organisation where I had my very first paid employment. So that's something we have in common, which was, of course, the Simon community. Bob, over to you.
Thanks, Sean. And I'd also like to thank CES and Campbell for the invite to today's event. And I suppose, in case nobody else says it, I'd like to pay tribute to all of the work of people who have been working on homelessness throughout the pandemic. Government departments, state agencies, local authorities, health services, not-for-profit organisations, homeless charities, housing associations, and other individuals that are out there working through thick and thin, through very difficult times. I want to talk very briefly. I'm just going to briefly describe Housing First, talk about the transformational power, I suppose, of an evidence-based practice like Housing First for clients, for people who are homeless, for government, for practitioners, and then talk briefly, like Grainia has, about system change. And just to say, it's a privilege to be on the same panel as Grainia Long and Jennifer Hanratty. The first thing to say is, I suppose, Housing First is radical. It provides permanent, immediate access to permanent housing for people who are sleeping on the streets and people who've been homeless for a long time. And then it provides very intensive visiting supports to their home, particularly focused on mental health and addiction. And I suppose there's a couple of things that are around that that are really powerful. The first thing is that there's no preconditions around sobriety or taking up treatment. So the staircase model is gone. The second thing is that while you can be evicted from a Housing First tenancy for all the reasons that we could be evicted from a Housing First tenancy, you can't be evicted from Housing First. So in other words, you will be rapidly rehoused under the programme. And I suppose the third thing is that you're promised time unlimited supports for the rest of your life if you need it. So it's an intense programme. The second thing is that it is probably one of the most rigorously tested programs in the world. It originated in the United States, very large randomized control trials. Wherever you deliver the model, you get the same results. So in the Republic of Ireland, we have an 85% success rate in moving people permanently out of homelessness. They're the same results that you get in New York City or Vermont or France or Spain. So deliver the model, get the results. So I suppose my kind of thesis for this few minutes of talking to you is that the values, in a way, that I suppose we associate with good research are actually part of the DNA of Housing First and are part of the reason that it's so successful in terms of rigor. So housing is based on some of those principles that I just mentioned. Confidence in what you know that if you deliver the model, you get the results, and kind of openness to new information. So also being open to the model being tested, because as Jennifer highlighted earlier, and this, you know, I've seen many presentations on this, it's very clear that Housing First increases housing stability in a very big way. It ends homelessness for most people that are involved in the program. The jury's a little bit out actually on the health piece. I think in the ways that people access health services definitely changes, but in terms of, you know, long-term impacts on health, the jury is out on it. Except I know I've seen some evidence in the USA for people with HIV and AIDS. There are kind of very measurable health outcomes. And obviously there are other parts of Housing First around social integration that really in a way are still ground that's fallow and needs to be pioneered a bit more. In terms of the transformational power of Housing First, because it's evidence, I think the first thing for people who are practicing Housing First, it gives them confidence that what they're offering is actually what people want. There's like, if you ask anybody who's homeless and on the streets, what do they want? I want my own place. And what you're offering is their own place without preconditions around that. So there's a congruence between the offer and the need. The second thing is, like, homelessness is a big dark cloud, but actually, you know, housing cures homelessness. And we know that for 9 out of 10 people who get this program, getting a housing will cure homelessness for them. So in a way, that big dark cloud is kind of out of the way pretty quickly. Like, my experience is that, you know, if homelessness is going to end for people who participate in the program roughly within 9 months. So that's done. So then you're moving on to the deeper waters of recovery around mental health, addiction and physical health issues. And also around that piece around social integration, because very often people, and this conversation normally starts on day one in Housing First, would you like to have a job in the future? And that conversation starts at the beginning, not down the road. And I suppose the other thing that's built into Housing First, I talked about that openness to new information. Service user involvement is a critical aspect of Housing First. Consumer choice is one of the principles of Housing First. Feedback is built into the model. Co-design is really a very much part of what we're trying to achieve. In the Republic, we haven't got there yet. And peer support, we do have peer support workers. So people with a lived experience of homelessness who've gone the full journey are now part of delivering the program. And they have something unique to offer, because sometimes when somebody disengages from the program, it can be the peer worker talking to them through the letterbox saying, I've been there, I know how you feel, can be the difference between them re-engaging with the program or not. In terms of the transformational power of Housing First for government, it's around confidence. Listen, there's all these trials, it's been done all around the world, lots of governments have adopted it. If you do it, it'll work. But it also gives government the confidence to come in and take a leadership role. And, you know, one of the reasons that people become homeless is because, in a way, housing has been separated from health and people fall between the gaps. One of the most powerful things around the rollout of Housing First in the Republic of Ireland has been the Department of Housing and the Department of Health providing joint leadership on the programme and developing a national Housing First plan together. And obviously, you know, my own role in terms of delivering for both departments. I think the second part is, because you've got principles and you've got an evidence-based practice, you can commission in detail, you can issue tenders that very clearly set out what you want. You can redeploy existing state structures. And you can set targets based on the need. So we know that about 20% of people who are homeless fall into the either episodic or chronic homeless category. You can very clearly target. And again, if you deliver the model, you get the results. I suppose the other thing is that Housing First highlights systemic gaps. So one of the things that when you start delivering housing to this particular group of people, it's pretty obvious you need one-bed properties. I don't know what the situation is in Northern Ireland, but I'm pretty sure it's probably the same as the Republic, where one-bed properties are like hen's teeth. So it highlights a systemic gap. And of course, one-bed properties are needed not just for people in the Housing First programme, but people who are homeless generally, and lots of people on local authority waiting lists. It also highlights that there are people in properties who probably need more intensive support. It's not Housing First, but they need more intensive support, because very often when we start a Housing First programme in an area, what happens is people said, we have people in properties that could actually do with this kind of support. And I suppose the third thing is it highlights health service gaps. Like, you can't deliver mental health supports if there's literally no mental health services in the area. And monitoring, without getting into it too much, monitoring, action research and evaluation are a big part of the Housing First programme here in the Republic. And I suppose action research is interesting because it's really like a smoke detector. As you're delivering the program, you're talking to the people who are delivering the program anonymously, you're highlighting challenges and you're trying to resolve them. you know, an evaluation can sometimes be a bit of an autopsy, but it still provides very valuable information about how you design the program going forward. I suppose in terms of practitioners, I think the most important thing is it's actually forging new relationships. I was really taken by what Grainia says about collaboration. Like, collaboration is the solution to, you know, the wicked problems that Grainia talked about, the complex problems. Housing First, in a way, gets the people who've been working on homelessness for decades, people in local authorities, people in health services, and obviously people working in homeless charities and housing associations to work together in a very integrated way to support a group of people. And there are two steps to rolling out the program. I suppose one is awareness of the program. And like, this is where the evidence comes in. This program works. I know you don't believe it. The idea that we can move this guy from the street into accommodation without putting any preconditions on it, and it'll work. Like, for many people, it appears like a miracle, but it is the intensity of support and the fact that that person has got permanent housing that makes it work. I suppose the other thing in terms of just looking forward, in some places, where there are no homeless services or hostels, but there are homeless people, Housing First can become the primary response. In other words, we're bypassing the last 50 years of delivering homeless services and giving people what they want from get-go and starting from a new base. And the other thing I think is that part of Housing First is definitely this idea of self-improvement. So there is a sort of strange term called fidelity associated with delivering Housing First, which is really about judging yourself and your program versus the principles of the model and keeping doing that. And actually, we've been doing fidelity assessments across all 9 homeless regions under the Housing First implementation plan here, and people are doing really well. And then this idea of creating a community of practice that's also multi-sectoral. So again, a community of practice that actually involves people in the front line, in local authorities, in health services, and homeless charities working together when really they would operate separately under any other kind of set of circumstances. And finally, just to talk about system change. What are the system changes that are created by Housing First? I think the first thing is that everyone's moving closer to the exit of homelessness. From get-go, the person who is homeless is being offered housing. They're being offered a way out of housing within a very short period, or a way out of homelessness within a very short period of time. Like, my experience, having worked in homeless services for a long time, is there are many people who are working in homeless services today, and indeed for many years, who've never seen a homeless person exit homelessness. All they've seen is the chaos in hostels, or, you know, the difficulties that people present. Like, Housing First moves everybody towards seeing that. And once you've seen it once, you become addicted to that. You want to see more and more of it. I think the second thing is that piece I talked about the integration of housing, health, and other supports, including things around, like, you know, criminal justice supports and so on. So when you're going to that person on the street, you're not offering emergency accommodation anymore. You're offering permanent housing. You're offering treatment. You're offering a direction, you know, you're offering a way to employment and so many other things. So offering a package that person wants. The other thing is, like, when we start delivering Housing First, we do ask people to think about reconfiguring homeless services. So even though we're continuing to use hostels and indeed build more hostels and acquire more hostels, in doing that, are we thinking about, can we convert that to apartments in the future? Can we start the process of dismantling the hostel system and building a housing-led system? And Housing First very much allows us to think about that. And I suppose the final thing is, obviously, you know, the goal here, the overall system change that we want, is that housing becomes the primary response to homelessness, housing with supports for people who need it. Not everybody, 80% of people who are homeless do not need much support, but there is a group of people who will never leave homelessness without getting the very intensive support that Housing First provides. So I suppose the evidence for Housing First allows us to dream about a future where we've completely turned, you know, some of the maybe sacred cows about how we deliver homelessness on its head. Thank you very much for the opportunity to speak to you today.
Thank you very much, Bob. Really great to get insights from the heart of someone who's implementing an evidence-based model and talking about the challenges and benefits, and I'm sure we'll come to that in the group discussion. Next up, Miguel Mcgluskey, an old colleague of mine from many years. Majella leads up the Centre for Effective Services work in Northern Ireland. As I said in my opening remarks, it's an organisation that helps government departments, agencies, organisations, whoever, to try and incorporate evidence into their practice, but perhaps more significantly, they have a real focus on the challenges of implementing what works, not just identifying what works, but then the challenges of actually turning that into something that can be operated by a system. Before she went to CES, she had a number of senior roles, particularly in the third sector. And I think I first met Majella when she was chief executive of the umbrella organisation, leadership organisation for the third sector of Northern Ireland, CO3. She also has been awarded a Winston Churchill Memorial Trust Fellowship, which I think is possibly ongoing, giving her the opportunity to look more about the use of evidence in policy development in other societies. So, Majella, you're very welcome, and over to you.
Thanks, Sean, and thanks also to Jennifer, Grainia and Bob for 3 very complimentary and interesting and honest and open contributions. We're delighted to be partnering with the Campbell Centre at Queen's and bringing this event today. And it's because we're an organisation that's fiercely committed to sharing and using evidence to make a difference on the front line of policy and practice. And that's where I'm going to bring us to next, namely how we might go about using evidence in a practical way to improve services. In doing so, I'm going to draw a little bit on our work in housing, which tracks back as far as a 2013 review that we did of the implementation of the youth homelessness strategy in the South, right up to work we're currently doing with Respond Housing Association, but also importantly, our wider work in mental health, social care and addiction services across the island. So supporting how we use evidence is something we've been undertaking in CES right from our doors opened really over a decade ago. And I suppose we'd love to think now that our colleagues in Campbell have done all the hard work that we have the answers we need and we can immediately start changing services. Unfortunately, we all know it isn't as easy as that. And our thinking on using evidence to improve services, I suppose we've come to think of it as a journey. And like all good journeys, it needs planning, resources, and thinking through. And whilst evidence can come with its limitations, and Jennifer talked about those earlier, every good policymaker and practitioner who wants to improve outcomes will seek to keep up to date with what evidence is telling us and take opportunities to introduce this into policy or practice when they can. But at what point would you seek to implement evidence into policy or practice? And what might some of those considerations be? And as Sean said, we've been supporting implementation across the island of Ireland. And I'm going to just share 3 factors to whet your appetite for getting started on implementation. And the first is something that Jennifer's already mentioned, and that's context. An implementation scientist called Pierre Nielsen has said, accounting for the influence of context is necessary to explain how or why certain implementation outcomes are achieved. By context, I'm really meaning the outside influences in the wider political, the policy, or the administrative arena. You've probably already been listening to Jennifer and considering how different or similar the wider context in which the evidence was gathered is to where it could be implemented. And it's really tempting to focus on those differences and maybe dismiss evidence because the context is so different. But it's more challenging, but certainly more rewarding to look more closely and carefully and consider what usable results could be applied. And when we in CES think about context, we also think about the services that are already there, that the things that are already in place on the ground, who's already delivering what. We all know in housing terms, policies and services are really different on different parts of the island, with central and local government, the housing executive here in the north, as well as housing associations, local and very important third sector providers, but they're all operating quite differently in both jurisdictions. Nevertheless, you know, we should think about when we're applying that evidence, just taking account of what is already there. On some occasions in CES, we've mapped that policy and services landscape so everyone's clear about how this new evidence is different or fits in. And I think it's important to say that context isn't fixed. Our colleagues in the National Implementation Research Network talk about the importance of an enabling context for successful outcomes. Policymakers and commissioners can become more encouraging of using evidence, and it was fantastic to hear Grainia talk about that earlier. It underlines for me the importance of working upstream to influence policy and strategy for greater use of evidence, including events like today, I suppose. I also, before I finish talking about context, want to underline the value of growing evidence in existing services. We've had some discussion with some providers in the run-up to this event about this very point. When we were delivering the National Lottery Community Fund's Impact of Alcohol programme, our third sector services who were providing support with alcohol or drug misuse or addiction, we observed they were really poorly served with resources for gathering data and building evidence about what works on the front line. And we think this is an area that needs further exploration and investment. The second dimension that we find to be critical for successfully implementing evidence is readiness. And when I talk about readiness, I'm describing the extent to which people, individuals in services feel equipped and trained and supported to implement new ways of working. And I'm describing the extent to which organisations more broadly at the team, at the department, or even organisation-wide have the systems and feel collectively ready to try this new approach. I wonder what you think the readiness in your service or your organisation to start implementing any of the evidence that's new or interesting that you've heard today might be, and how you might start to find that out. We've found that assessing readiness to implement new ways of working is pretty crucial. And to be honest with you, I got that lesson pretty early in my time at CES when we were supporting change as part of the early intervention transformation programme. We found it was pretty easy and straightforward for people in health and education to come together, plan new ways of working at regional level. However, when we developed a readiness assessment and went out and interviewed leaders in their own health trust settings, we found a completely different response. And I see my colleague Mel on this call, and at the risk of re-traumatizing her on some of this, we find these interviews surfaced concerns that hadn't been raised at the regional table, but were really critical. They were practical and logistical. We don't have the space to run this service, as well as concerns about duplication with existing approaches. We're already doing this, and a stronger affinity with homegrown services, or indeed a concern about a manager who wasn't on board in the same way as their staff, or vice versa. It identified a need for a further phase of implementation support that proved vital to embed the change. We've gone on and used readiness assessments more widely and consider it a pretty essential first step in assessing the preparations that's needed to start something new. Readiness is growing in recognition academically, and it's widely accepted in practice. And it's helpful to think of it both in terms of assessing it, but also building it. And it may be useful to think about the resourcing that's needed to build readiness, to look at the internal changes, the policy changes that might be required internally, and how you can support staff. So having assessed readiness and thought about context, considered all of that, then how would you start to get going with implementation? So implementation science, and indeed CES's own practice, has surfaced clearly identifiable factors that help us use evidence, and others that feel more like hurdles to be overcome. We talk about enablers and barriers. So critical enablers, as Jennifer's already mentioned, some of these include leadership. And we find that it's really vital that that's distributed throughout an organization or a setting. An implementation team is also critical, and that's a team that's there to roll up their sleeves and do parts of the work rather than formal governance or scrutiny. Clear, open communication, investment that will let you try something new, supports to build the capacity of a team to use the evidence in the clear, defined ways that, again, Jennifer referred to. Those are all critical enablers. So CES has been supporting evidence use amongst social workers in Tusla over the last number of years through a programme of capacity building, combined with mentoring supports, ready access to evidence, and that's been evaluated in an ongoing way as part of our EPI programme. It's proved to be really helpful. Where there is a lack of resources, invisible leadership, a fear of change that limits communication and openness, or a lack of staff training, or indeed a large turnover of staff, these can stymie the implementation of evidence and new ways of working. I think it's important to say that in CES, we've seen many organisations recognise and build those enablers to really successfully help them implement change. And I think that's a model that could be shared more widely. I just want to finish by saying that if you're interested in implementation, my colleague Mark has shared our guide to implementation, which is on our website, as well as a link to our collected implementation resources. There's an implementation network on the island of Ireland. It meets twice a year, and it could also be a useful source of support. And if you'd like to talk to CES about how we might help you implement change in your organisation, please get in touch. Thank you, Sean.
Thank you very much, Majella. I suppose really, if I was to sum up all of that in just a couple of words, it might be, why does what works not work sometimes? And those are really important questions. Anyone who's been around long enough will have seen large amounts of financial and human capital expended on things which didn't deliver the things that they really should have delivered. So it's a critical question. Okay, we're now going to move into the part of the event, which is the panel discussion. I've been keeping an eye on the chat function, but I'm not going to go to the chat function for my very first question. I'm going to steal a question that actually was being asked between the presenters before the event started this afternoon. We got together virtually and had a little bit of a chat. There was a point raised about COVID, and I'm going to pose the question to the panelists, and I'll go to Bob first with this. COVID obviously has been a threat, it's been a challenge, but to what extent in the field of homelessness has it also presented us with opportunities, and have we made good use of those? Bob.
Thank you, Sean. So I suppose the first thing to say about COVID is that I think that it has not been the threat in a way to people who are homeless that people expected, and that's because in a way we're always working in a situation of kind of crisis, and I also think like I work in the Dublin region homeless executive here. When we heard about the coronavirus, I'm just remembering back to mid-February, we said to ourselves, that's going to affect us and our client group. And I just think that we had 2 or 3 weeks ahead of everybody else when we just knew something was coming our way. And the good thing is that, in the main, people have been protected from COVID here. What have been the opportunities? The opportunities of obviously all the tourists have gone away from Airbnbs. A lot of properties have been left vacant, and we've been able to take opportunities in both in hotels and in standard properties to protect vulnerable people, particularly people who are obviously with health issues who need to be protected from COVID. The second thing is that because the response to the coronavirus has been health-led, it has meant a much more closer collaboration between housing and health. And that's had like even on the streets at the moment, in terms of dealing with rough sleepers and helping them and supporting them, we've seen senior officials from the Department of Health and the HSE go onto the street to look at people's mental health and addiction needs, to getting them faster access to treatment, getting them faster access to addiction services. And I suppose the final thing is that it has created that situation, again, I go back to what Grainia said, of kind of true collaboration at all levels. And the only thing I'd say, Sean, the threat here, of course, is that that doesn't continue after COVID, that we all go back into our jam jars, into our silos. But I think COVID has probably gone on long enough now for some things to have changed forever. Like just one small thing, like for 20 years, people have been looking for methadone basically to be delivered to people's doors rather than people going to methadone clinics to get methadone. That change happened within a couple of weeks once COVID was onset. I don't see how that's ever going to change again once people have had that experience. Thanks.
Very positive point to end on, Bob there, though. I wouldn't underestimate the muscle memory of organisations, particularly large organisations, to revert to type and go back into a silo. Grainia, same question to you, from maybe a northern perspective in relation to COVID and opportunities and threats.
Thanks, Sean. And I think, in fact, I want to almost start with what you've just said, because the Housing Executive is a large organisation, and I think there's a huge risk that we could revert to type. And I've kind of been open and honest about that in various forums recently, and I just we're all working so hard to prevent that from happening, and so I mean we'll come on to kind of the why that might happen, and Majella's comments on why does evidence not always result in the change that we want. But just to answer the question, and I covered it a bit in my presentation, but kind of just to restate the point about real partnership and real collaboration is risk sharing. It's me saying to you, I'm going to put my resource, whether it's an organizational asset or money or a fund or staff team, we're going to put that along with your staff team. We're going to take that risk. We're going to do it together, and that's actual collaboration, as opposed to just meeting up every once in a while and telling everyone we work together. So I think that has been a huge opportunity, and the agility that we've all worked with. I think, though, what I would say is that it has underscored in public policy terms just how important housing is in terms of the stability that an appropriate home gives an individual or a family or a household. It has really underscored that, and it has focused everyone's mind, I think, on the fact that people who had secure accommodation did better. And the more secure and the better that accommodation and the better your living standards. I mean, it's exposed really big inequalities in society. And so as a moment to stop and say, right, how do we prevent a return to type? I think housing, it's always had a really important place, but I'm really hoping now housing is understood alongside health and education as critical drivers of kind of social progress and social justice. So I may be naive in that, but I'm not going to give up, because that is housing's role. That's housing at its best. And I think so. I think that the kind of, other than, I won't repeat what I said earlier about the kind of other lessons that we've learned. There was just a point I wanted to, and you might want to come on to this, but there was just a point I wanted to talk about in relation to why evidence doesn't impact necessarily in the right way. And I think Majella's points on context were really important here. But the other I would add is, do we focus on the problem or do we focus on the solution? So, I've been as guilty of this as everybody, of thinking, right, I understand the problem, so I'm going to jump right in, and I'm going to list what I think the solutions are, and then I'll commission research to tell me whether those solutions are the right one. When actually, what I learned, I wish I'd learned it when I was 20 as opposed to learning it, when I was 30 or 35. Actually, spend more time on the problem. Spend more time understanding the problem you're trying to solve, and design the evidence a bit more effectively around that. That's just one of the lessons I've learned in terms of organizations and organizational change. We jump right in because we think we know the answer, or we think we know the solution, whereas actually we need to spend more time on understanding the problem.
Thanks for that, Grainia. I mean, really interesting point, though, and it's come up in the chat, I suppose, a little bit about this tension between one of the great benefits of COVID in public policy.
I thought thought that only happened to me, Sean.
No, that's going to be that happens regularly. But one of the great lessons from COVID, I think, has been that people have moved at great speed. And it's a point that's come up in the chat that, you know, sort of maybe one of the lessons was that instead of endlessly reflecting on evidence, people took very quick choices. I think it was Mike Ryan from the World Health Organization said, whatever you do, act quickly. Doesn't that create a tension between, you know, sort of following evidence and actually delivering rapid change? And I'm going to put that Jennifer and Majella, I think. So Jennifer, firstly.
Yeah, I think you're right, because with the COVID crisis, it galvanized lots of different people to work at pace and to work together. And the pace of production of evidence is slow at the best of times and glacial compared to the pace of change that we saw during COVID. And so I think that there is a mismatch there in terms of the pace of generating evidence and then the pace that services need to operate at. But I think that what I would hope that it presents an opportunity that when organizations are now kind of at the point where we're thinking about, well, what have we learned over the last 12 months and how can we build back better? And we have this phrase that keeps making the rounds about building back better, that actually I would hope that there is a pause and a chance to actually look, well, actually there is evidence that exists. We don't necessarily need to have new evidence all the time. We can actually go and cast our eye over the evidence that we already have. And I think that the resources that CHI and Campbell UK and Ireland have produced can support that process. So I think having that opportunity to pause and actually look at what the evidence already is, would hope that evidence can be kind of included in that building back process going forward.
Majella, same question to you. And I mean, I suppose it's almost a tension between, you know, all the references you were making about context and preparation and building the context for implementing evidence against momentum, speed, breaking through long-standing barriers.
Yeah, it's a really interesting area, and it's something that we looked at right from the sort of outset of the pandemic. We hosted one of these events on the very theme of rapid implementation, and you know, trying to figure out what we were learning. And at the same time, the CES team in the north was delivering work with a number of community planning partnerships who were responding in a very active way to the pandemic. I think there's a couple of things I would say. I think Jennifer's right. I think there is a lot of evidence that's known but not implemented. And I think what happened is that people found an opportunity, barriers were stripped away, and there was an opportunity for people to start to use the evidence that was already in existence. And I think Bob gave a really great example of the methadone deliveries. You know, that was a really good example. I think that was about people removing barriers, genuinely collaborating, taking some punts and trusting people in a way that they maybe hadn't before. I don't think they had any choice. And I think some of that might also have been about the leadership that was given from the very top of systems to say, look, we have to try something new, we have to try something different. So that would be my sense, is that there's been, you know, this rapid implementation. I would agree with Jennifer that we do need to make sure that we learn from this. There will be really good things that we'll be able to take forward about the relationships that we can rely on and how we can involve different types of sectors and so on. But we will also need to think about what some of the unintended consequences might be, and where some groups of our society have perhaps been left behind.
Okay. Collaboration was mentioned by, I think, nearly everyone who spoke this afternoon as being a significant feature. And certainly my experience of COVID has been people have collaborated the way they've never collaborated before. I mean, arch enemies have suddenly been enjoined to work together collaboratively. And that's been great. But I'm wondering, is the problem that when we look at collaborating in taking evidence-based approaches, is the evidence just doesn't fit how we're organized in government terms? And you know, I'm thinking about Bob talking about the partnership between housing and health as being a successful sort of example that bucks that trend, but generally is one of the big problems about how we just, our organizational architecture isn't designed to utilize evidence. And go back to Jennifer maybe for a first thought, and then maybe Bob and Grainia from service point of view can give me a reflection. Jennifer.
Yeah, I suppose I'm not really sure that I'm best placed to respond to that, actually, because we're very much, and I said that at the outset, we're very much in the kind of synthesizing of this evidence, but actually the integration of that evidence into policy and practice, I think probably Bob and Grainia are much better placed.
I suppose, Jennifer, I was thinking particularly about a remark you made about where one of the features in not being successful was where you had people sort of deeming this as not being their role. And that sort of is something that anyone who works in government frequently has that discussion, either positively or negatively, and it's about saying, well, yeah, I recognize the problem, I understand the evidence, but really this isn't my job. So that was the perspective I was coming from to you.
Yeah, so I think in terms of that particular piece of the evidence, that was something that we found more at the level of staff who were kind of delivering programs and directly working with people who are in need of services. So I think it's at that level where that came through strongly in the evidence, in terms of that sort of sense of responsibility, that homelessness was something that was part of the job. Somebody who was working in emergency care, for example, that preventing homelessness or not discharging somebody into unstable or unsuitable accommodation, that having that sense of responsibility helped to people to embrace interventions. But we didn't see that much, and maybe we weren't looking for evidence that was actually looking at that kind of broader policy level and in terms of the implementing agencies.
Bob, you talked about this in a positive sense, where you referenced the partnership between housing and health, and I see someone's referenced in the chat the very low instance of COVID amongst the homeless population against what was anticipated as being evidence of collaboration across different portfolios. Any reflections?
Yeah, I mean, my reflection, Sean, would be in relation to housing first. I think that what happens is that very often people don't act because they're afraid they're going to be left holding the baby. And I suppose what an evidence-based model like Housing First allows us to do is to people to play to their strengths. So the housing department provides the capital money for housing and the tenancy supports. The Department of Health is clearly responsible in the HSE for mental health supports and addiction, and indeed funding that. And the NGOs do what NGOs do best, which is that person-to-person supports. So everybody's coming into the room knowing that they're mutually accountable, but also that they're only being asked to do what they're supposed to do. And obviously, the power is that if you do that, you already have evidence from all around the world that coming together in this way will impact on your client group. So the impact for obviously the Department of Housing is less people are homeless. The impact for the Department of Health is less people sort of chaotically using A&E services. And the impact for NGOs is that people get to move permanently out of homelessness that have been in their services perhaps for years, if not decades. Thanks, Sean.
Yep, Grainia?
Yeah, to answer the question you asked in relation to organisations, are they kind of large, well, any organisation is kind of capable of institutionalising evidence and using it to change. My view of this is organisations are still made up of people, and the systems are there, but it's the people who design the systems, they build the systems, they break them, they fix them, and so I think that kind of culture change that you're talking about, Sean, which means if you're going to do collaboration, you really do it as partnership, as risk sharing, and so on. Then that really does mean changing mindsets within the people across the organisation. It very much can be said at the top in terms of empowering colleagues across an organisation to take risks. But to Bob's point, and I couldn't agree more, if we allow and when we allow skilled professionals to use their professional judgment and take risks, as all of you do every day, all of us do every day, then you have to allow that some failures will happen. And actually, we expect perfection all of the time, and we accountability processes and KPIs. It's just that's, for me, that's the system that we allow to be built up, and actually individuals can change that. So I think what's been helpful about what the pandemic's taught me is that if you can't say it, you can't speak out of both sides of your mouth in this, you can't say it and not do it. If we're going to allow people in organizations to take risks, then you have to allow some things not to go as well as they could have, or some things not to go well because it was a bad idea. But you know, if you hadn't tried it, you wouldn't have learned something from it, because you move on to the next thing. So that's important. If anybody's interested, read a book called The Blunders of Our Governments. It's about 5 or 6 years old, and it's written by 2 academics that took case studies of systemic failures across the UK government, across maybe, I think, like 8 or 10 case studies. Obviously there were trends, you know, there were certain things that happened in each case study, but it, you know, spoke to some of the issues that you raised, Majella, about how evidence is either, when it's used and used well, it can be the difference between success or failure, but if it's not used or used badly, you know, real catastrophe can ensue. So I always recommend that book for discussions such as this. It's worth a read.
Okay, thanks. I'm going to take a slightly different turn now, and again, it's responding to something that's come up in the chat. Slightly technical question around quantitative easing, but I'll take chair's privilege and paraphrase it slightly. I'm really struck by the fact that, you know, we've been talking about homelessness now for an hour and a half or so. I'm not really heard much discussion about poverty, and yet in many forums, if you go to talk about homelessness, or if you talk about poverty, you get an awful lot of discussion about the relationship between the two. I'm not going to offer any judgment on that, but I'll just ask for some reflections from people about why they think that we haven't had a conversation which has had much of a focus on social justice and poverty, when so many conversations about homelessness do feature that very significantly. And I'm going to leave it to whoever of the 4 of you wants to come in, just raise your hand and make a point. If you don't, I'll pick on you.
I think you're right, Sean, that it hasn't been more explicit, and it's interesting that it hasn't been more explicit in the conversation. Although I think, and all of the speakers have alluded to it in one way or another. I think it also speaks for me about how we build in the voice of the service user, the person who's experiencing homelessness, into this work. And I suppose it also almost answers for me your last question as well, which is about the role of co-designing these services with evidence in mind, but also with the people who are using those services. And I think, as Grainia indicated, this pandemic has definitely exacerbated inequalities in our society, and I think we haven't really seen the full extent of that as yet. I think when we start to see kids progress through school, for example, it'll become more explicit. I think as we start to kind of return to so-called normality, I think we'll start to see that become more explicit. But I think it's a really interesting point that you make, and I think something probably other speakers will want to pick up on too.
I'm going to go to other speakers in a second, but Majella, can I pick up on something you've just said about service users and their voice? I mean, you know, is it a situation, because I mean, I've certainly come across, not in this field, but in other fields, where there's a tension between people who believe there is the evidence owned and generated by professionals, and they know best, versus the voice of the service user. What I think I'm hearing from you is that a proposition that evidence isn't worth tuppence if it isn't informed by the service user voice. Is that something you'd argue?
Well, I mightn't put it in quite those terms, but in CES recently we have gone through quite an interesting internal process led by my colleague Claire Hickey, where we have just clarified our internal understanding of what we believe evidence to be. And we've always felt it to be, but we've reiterated the fact that we believe it to be, to include the voice of both the practitioner, as Grainia and Bob have just indicated, but also the person who's using the service. And it obviously brings some difficulty in how we quantify that against the very robust evidence in traditional terms that Jennifer has discussed, but it's absolutely part of the jigsaw puzzle of how you design good services, in my view, and in the view of CES.
Anyone else want to come in either on the poverty point or the evidence being informed and shaped by service users and how that contributes to quality of evidence? Bob.
Thanks, Sean. I mean, as I said earlier, like one of the principles actually of Housing First is like, it's called consumer choice, but what it means is, in a way, the program is directed by the person from day one in terms of where they want to live, you know, the kind of housing, I suppose, within limits but there is real choice within the Housing First program. It's not just, this is the only house available, you can have that. There is really, it's built into the program. I suppose then you go into, as part of our national evaluation, talking to service users at great length about their experience of the program, which is always enlightening. You know, the recent in the USA, the recent had the sort of every 2 years they have a Housing First Partners conference. There was a very good presentation about service user, what they call consumer boards, people involved in designing the program who are service users. And then, as I said earlier, people who have gone through the program or exited homelessness with a lived experience of rough sleeping or mental health issues, or being part of the delivery of the program. And that's actually core to Housing First program as well. So having people who've had the actual experience delivering it. So I think there's like gradations of service user involvement, but you can't go wrong if the service user is always at the heart of delivering the program, because they're going to tell you straight up whether it's working for them or not.
Okay, just if anyone's interested, there's an organisation, the New Economic Foundation, who've done quite a bit on the role of co-production in designing services that fundamentally work, if people want to follow that up. We're running out of time, and this has been meant to be focused on evidence and implementation. So I want to finish with a point about this, and it's about the, and I think Majella talked about context being very important, but equally Bob referenced implementing a program, and if you implement it with great fidelity, you're regardless of where you are getting the results that you're meant to get. So I'm wondering if people have any thoughts on the challenges about taking evidence about complex social issues where cause and effect are very difficult to establish, where you don't control variables in the way that you can in a traditional laboratory environment. I mean, it's just not like that. What are the risks, and what fears should we have about transporting, particularly given the volume of evidence that emanates from one country in particular, America, on social issues? Any thoughts on that point about context and socio-cultural context and its relationship to implementing evidence-based programs?
I have a couple of thoughts on that one. I think this conversation has been really, I found this really helpful and really insightful, because I mean, ultimately, I think, Sean, what I'm thinking about is good decision making in organizations. So in other words, you've got a problem you're trying to solve. You've got several ways in which you can solve it. And I'm assuming it's a kind of an easy to define problem. And then you've got to make a series of decisions in the right way. And so I think if you have the right approach to that, and I don't want it to sound too processy or transactional, but in my experience, the best organizations are those that do decision making well. So they do a whole host of things, much of which we talked about today. They involve the customer, the service user at every stage. And whether it's either involving them directly or whether it's involving them indirectly through their insights or data or so on. But it's, if it's a services oriented decision, then the person who's receiving that service should be core to the decision. You've got the right level of governance, but it's to go back to my earlier point, it should be reasonable and proportionate, and actually evidence should be an enabler. And if evidence isn't an enabler, either doesn't play a role or becomes a blockage, then the process you've gone through is not the right one. So I think my takeaway from today, and it genuinely has been really helpful, is I kind of want to go back now and say, how are we getting the decision making right? Where does all of this fit into the decision making? Because often it's just the right person asking that question. What's the evidence to support this? Or the evidence doesn't support this, or prove it to be. So sometimes it's simpler than we give it credit. I think I just wanted to cover the point about poverty because it's really important, critically important. And I think, in a way, to be blunt, let's not kid ourselves. While we started off quite rightly saying that COVID is a moment from which we should learn, the problems that were around before COVID have not gone away. So issues of systemic poverty and inequality, and in some cases, real destitution, across generations, and that in I would imagine in most cases it's been worsened, and at best it just hasn't worsened, but it's still there at the level it was. As has been said, we expect over time to understand more, because again we're only seeing the emergence. So I think we shouldn't, and I say this to myself as much as I do to everybody else, we shouldn't assume that the positive lessons from COVID, we shouldn't just focus on them to the detriment of. There are some really big and systemic challenges ahead, and one of them is worsening poverty and inequality. And I feel passionately that housing should be valued much more as a problem solver in terms of poverty and inequality. And I think it hasn't always been, but I think if we get our way, many of us, it will be in the future, because the evidence shows it has done.
Thanks very much for that, Grainia. I'm afraid we're running out of time, so I'm going to put you on the spot, 1 minute each, any final reflections, and it really is a 1 minute each kind of situation. And feel very sorry for, sort of everyone's hoping to be the last person in this, but I'm going to come back to you, Majella, and then Jennifer, then Bob, and then finish with Grainia.
So I just wanted, I think, to finish by saying that we shouldn't miss the opportunity of gathering evidence and improving services where people are at. Thinking of examples like the Parenting Research Centre in Melbourne, Australia, that we work very closely with, who are doing exactly that, going to where people are at and gathering evidence and supporting service improvement where people are at. I think it's been a really interesting conversation, and I look forward to, following up with people afterwards. So thank you, Sean.
Thanks, Majella. Jennifer?
Sean, you mentioned earlier on somebody from the World Health Organization in the context of COVID, and they talked about this idea before of don't let perfect be the enemy of the good. And while, when I'm talking about the evidence, I'm saying that, there's caveats around some of the evidence because some of it's not of high quality, but actually there is some really strong evidence that directs, that we know what works in certain contexts. And Bob highlighted that with Housing First, very much that robust evidence being able to be applied, and that rather than actually being slavishly following the evidence and worrying about the fact that, there hasn't been a trial in this context, that actually you take it, you try it, and you evaluate it as you go. And it doesn't have to be perfect, but that the evidence base is there for you to use and use it to fit however you need to use it to inform your decision. It's only one part of your decision making, but it's an important part, and the evidence is available. And people like Centre for Homelessness Impact and Campbell are working hard to try to make evidence more accessible and available to the people who want to use it.
And I suppose that kind of practice also continuously grows the evidence base as well. Bob?
Yeah, just to follow on from Jennifer's point, I think that researchers and policymakers often work in different time zones. So it's very important that if you have evidence, that you use it now. For instance, we're developing the national housing policy called Housing for All. It's going to be published this summer. It's going to set the landscape probably for the next 5 years. So people need to come forward with evidence, because there's plenty of people who will be loud and eloquent and have no evidence whatsoever about what they're looking for. I think the second thing is that evidence needs to be renewed all the time and underlined. And we shouldn't be afraid. I mean, obviously quantitative evidence is probably the gold standard, but there's no question when it comes to homelessness that it's such an emotive issue, that having powerful stories about people leaving homelessness forever has to be part of that, has to be part of the evidence that you're presenting.
Okay, thanks very much, Bob. And finally to you, Grainia. And you're on mute.
Thank you, Sean. I just wanted to finish on an optimistic note to that point around, how we use evidence to kind of enable collaboration. I don't think I've seen a time here in Northern Ireland where there's been more openness to collaboration and sharing of risk and sharing of data. For example, we're just about to start a piece of work with Queen's on a public health and housing project where data sharing is at the core of it to enable us to solve problems and so on. I think there's an openness across the public and voluntary community sector that I haven't seen for a very long time. So echoing Bob's point around, I think where the evidence exists, find the touch points, find the entry points. But I think the days of holding on to the problem yourself and solving it internally until you fixed it and your terms are over. And if they're not, we need to keep poking at it, because I think, as I say, the last year has shown us what's possible.
Okay, good to end on an optimistic note. Absolutely vital in these days that we do retain our optimism. Thank you, all of you. Very quickly, and some people have already started doing this, if you want to provide any reflections on this afternoon's event, fire them into the chat, and those will be captured and will help inform future events. I really want to thank all of the speakers, definitely, because I think you've all come. I mean, doing these things is difficult, these online new ways of working, and you never quite know how sort of balance, casual versus nerves when you're not actually in a room in front of hundreds of people. But I think you've all done it very admirably and very coherently. So I certainly have a lot to take away from it. I also want to thank some people who've been behind organising this event. Paul Murray from Campbell has been involved, along with Majella, in sort of deciding to do this and contributing. Mark O'Kane and Niamh Farron have been doing a lot of the technical work, putting this all together. And trust me, this is a lot harder than simply booking a hotel and deciding, are we having scones or not? Doing it virtually is quite a technical feat, and I think we've managed to do it without any major problems other than my dogs. So thanks to Mark and Niamh. Folks, that is us at 2 minutes over time, so I'm going to close it there. Thank you so much for taking time to join this event, and I suspect that we're going to see more events like this, looking at the really wicked, challenging, difficult problems coming forward from both CES and Campbell, and I think that's something we can all welcome. Folks, thanks very much. Have a good afternoon. Bye-bye.
Thanks, Sean.